Hi, it's Patrick from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my partner is in intensive care on a ventilator. The intensive care team wants to do a tracheostomy and I want to have him extubated. What do I do? Part 8. This formed part of an 8-part consulting strategy session for one of my clients who signed up for one-on-one consulting with me. You can check out the answer to last week's question by clicking on the link below this video. In this episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is from Heather, who I have consulted with in the past, and her question this week is: my boyfriend has pancreatitis and is in multi-organ failure. How long will it take for him to get out of intensive care? Part 1. So, Vanessa writes: hi Patrick, my boyfriend is in a long-term care ICU facility. He was admitted to ICU at a regular hospital on the 27th of December after being taken by ambulance to the emergency room. We are now at week 5. He's an alcoholic, had started seeking help through his company's HR 2 weeks prior to being admitted. He suffers multi-system organ failure and he was diagnosed with pancreatitis, was on the ventilator for almost 2 weeks, then switched over to a tracheostomy, and now he's still on the ventilator. His liver function was really bad, but no signs of liver cirrhosis. Pancreas didn't seem to concern them too much, even though he had pancreatitis. His kidneys were the worst. He had dialysis twice the weekend he was admitted, none for a week, then started it again to remove the fluids, and he was on it mostly daily dialysis for 3 weeks. He hasn't had or needed dialysis since Tuesday, so 5 days of dialysis. His kidney function is good, not retaining fluids like he was. I want to have him a neurological consult, but the intensive care doctors are dragging their feet. He has no history of respiratory issues, and yet they can't wean him off the ventilator. He gets too agitated, restless, tries to get up, heart rate and breathing goes up too. He also has almost constant tremors or shaking of his hands and arms, but his hands are the worst, like a Parkinson's type tremor. They keep him pretty much medicated even though he's no longer sedated, though he was on propofol for 3 weeks, so his level of awareness and cooperation varies greatly. He is now on quetiapine twice daily, clonidine every 6 hours, and lorazepam, haloperidol, and morphine at the nurse's discretion. He has also lost a lot of weight, muscle. His legs and arms are extremely withered and he seems incredibly weak. He has feeding directly into his stomach, and he had a bleed 2 weeks ago and he required multiple blood transfusions the 3rd and the 4th weeks. I'm having a lot of trouble finding any information regarding longevity of recovery in cases like his. I'm looking for prognosis for full recovery, also the likelihood will there be any permanent neurological damage due to the alcohol abuses, the liver and kidney failures, or how to tell not only if he has encephalopathy, which means damage of his brain, but which kind. The staff are mostly helpful but brush off questions regarding more serious long-term complications and tell me they've seen worse. I'm also confused as to why after 5 weeks there has been no attempt at starting even basic physiotherapy. No, he can't get up, but can't they move his legs, his arms, to help prevent him from becoming even weaker and losing more muscle tone? And how exactly do ICU nurses determine a patient is quote-unquote agitated? None, not nurses or doctors, none will even consider anything I have to say regarding what is normal behavior for him. That maybe he's not agitated, it's not anxiety, he's not actually trying to do more than to get comfortable or communicate. They're so quick to just dope him up even more. One last question, and I know I have a lot. Although he's not retaining fluids, his belly keeps getting hugely distended. It did this when the bleed was discovered. No signs of another bleed, and no one can explain what's happening or why, and even though it interferes with his breathing, no one seems to care. It has been an absolute roller coaster since this began. I just want a better understanding of what can happen, what kind of things to expect, timeline-wise, permanent-wise, best how to assist with his care, and how to educate myself to provide the care he will need down the road. Many thanks from Vanessa. Hi Vanessa, thank you for your question. First off, I'm very sorry to hear your and your boyfriend's situation. I know how you feel, and I know what emotional roller coaster you are currently experiencing. You also need to know that there is help at hand, since now you've signed up for my one-on-one consulting, and I will help you to the best of my abilities. First of all, let's look at your and your boyfriend's current situation in detail, and let's look at how you can improve the situation and in the process get peace of mind, control, power and influence quickly. So, okay, your boyfriend has been in ICU for 5 weeks. He has had a tracheostomy for respiratory failure or the inability to breathe. He has liver failure, pancreatitis, kidney failure, and he's a chronic drinker. The scenario that you are describing from a clinical point of view is nothing unusual. This means that critically ill patients who are alcoholics have liver failure, pancreatitis, kidney failure, often end up getting ventilator dependent with tracheostomy. Therefore, the situation that you and your boyfriend are dealing with is nothing unusual from an intensive care perspective. It's good to hear that your boyfriend has been off the dialysis machine now for 5 days. That's a good sign, even though you mentioned that he may need the dialysis machine again. Also, do you know if your boyfriend has been in intensive care in the past for similar issues? That would be good to know. It would also be good if you could share your boyfriend's age so that I can get a feel for how well he might recover. Age is not all that important, but it can make a difference. Regarding the dialysis and the kidney function and the fluid retention, it's most likely that due to the heavy drinking, the pancreatitis and the liver failure, he has been retaining fluids and the kidneys couldn't cope. That's often what happens, hence the dialysis machine. With the liver failing, there's also a high chance of fluids accumulating around the belly area as you've described. The medical term for it is ascites. This often also goes hand in hand with stomach or gastric bleeding, as he has experienced in the past. You also need to know that often with liver failure, the blood coagulation is getting deranged, and that's another reason why there may have been some gastric or stomach bleeding. And also with the ascites or the fluid accumulation around your boyfriend's tummy, of course that will impact and put more pressure on his lungs, and that will impact on him getting off the ventilator. It's probably more difficult. So everything you've described so far is nothing unusual from a clinical perspective in intensive care when patients present with pancreatitis, liver failure and kidney failure due to drinking. It's also nothing unusual that your boyfriend experiences respiratory failure and ended up on a ventilator with tracheostomy, and he's difficult to be weaned off the ventilator. Let's face it, your boyfriend is pretty sick, and now we've got to look at how to improve your and your boyfriend's situation in the short and long term. The biggest challenge that I can see is that with your boyfriend's chronic alcohol abuse, he's not only withdrawing from alcohol, he's also withdrawing from the sedation he has had before the tracheostomy. You are talking about tremors and shaking, and they are typical signs of withdrawal. It's most likely one of the reasons why the intensive care team isn't paying too much attention to what you're saying, what is quote unquote normal behavior for your boyfriend. Again, he's very likely not his normal, given that he's in intensive care on a ventilator with tracheostomy, and he's withdrawing from alcohol, sedatives and opiates, which are painkillers. That combination is a challenge, and that's why they are giving him clonidine, quetiapine, haloperidol, morphine, etc., etc. The chronic alcohol abuse is most likely taking its toll, and now that your boyfriend's health has crashed, he's facing all the challenges you are describing. It looks like he's not in a position as yet to tolerate everything that's happening or has happened to him as yet. He's also most likely in a position where he suffers from hallucinations, and he could be going through ICU psychosis and ICU delirium, especially after about 5 weeks intensive care with multi-organ failure, alcohol withdrawal and induced coma. That doesn't neglect the fact that the intensive care team shouldn't be treating you the way they treat you, and I will address that in a minute. As far as your boyfriend's ventilator dependency goes, please check out this article or video here, and you should be clicking on the link. So the video is about tracheostomy and weaning off the ventilator. How long can it take? If you're on our website, just go down to the written version and you can see a link. And if you're watching this on YouTube, just Google intensive care hotline, tracheostomy and weaning off the ventilator. How long can it take? And you will get a link to the video and article. It's also no surprise, Vanessa, that the intensive care team doesn't want to give you too much insights into what's happening in the future. It's hard for them to predict as well. Before your boyfriend can be weaned off the ventilator and the tracheostomy, his kidneys and liver need to recover first, because otherwise he will lack the strength to be weaned off the ventilator and the tracheostomy. After his major organs such as kidney and liver have recovered, the next steps are to wean your boyfriend off the ventilator. Remove the tracheostomy and then get him out of intensive care. The tracheostomy doesn't necessarily have to be removed for leaving intensive care, however, it would be a bonus, of course. However, I couldn't agree more with you that they need to start physiotherapy rather sooner than later, and that they need to keep up his muscle tone so that he maintains and not loses strength. There is absolutely no reason why your boyfriend can't have physiotherapy. I can't believe your boyfriend hasn't had physiotherapy for 5 weeks, any ICU that I worked in, they're always doing physiotherapy pretty much from day one. So, your job therefore is to start managing the intensive care team and get what you want. You should certainly be asking for what you want in no uncertain terms. For example, physiotherapy. Get comfortable with challenging the perceived power and the perceived authority of the intensive care team if you want to get peace of mind, control, power and influence. If you don't want what 99% of the families of critically ill patients in intensive care who don't have peace of mind, don't have power, don't have control and don't have influence get, you need to start acting very differently, and you need to start to proactively manage the intensive care team so that they don't manage you. You should also continue asking questions, no matter what those questions are and no matter what response you get from the intensive care team. Your job is to have as much peace of mind, control, power and influence as possible, and you can get that with my help here at intensivcarehotline.com, and that's probably why you signed up for one-on-one consulting with me. You most likely realized that the approach that 99% of the families of critically ill patients in intensive care are taking isn't working. You have realized that if you want to have peace of mind, control, power and influence, you need help. Good for you that you are seeking help through my one-on-one consulting. It'll be all for the better. Vanessa, I understand the roller coaster that you are currently experiencing, and I know it's nothing short of a once-in-a-lifetime experience. I have worked with thousands of families in intensive care in a clinical environment as well as through my consulting services, and I know how you feel. I hope that helps. Stay strong, keep asking questions, and start managing the intensive care team. So, how can you become the best advocate for your critically ill loved one and get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care. And how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. Or you can call us. Find international phone numbers on our contacts tab. Also check out our product section, where you get more ebooks, videos and audio recordings, and where you can also book one-on-one consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.